Good afternoon, dear colleagues, dear participants. I welcome you to this webinar, and I would like to talk to you about a situation in Ukraine with regards to reproductive health status in Ukraine and how we can ensure reproductive health in Ukraine. And of course, first of all, I would like to tell you that during my presentation, you will hear the following phrase, during the war. And of course, that's because we have the war in Ukraine and there is the impact of war onto reproductive health as well. So if we look at the status of how reproductive health is ensured, we usually look at it the way you see it in front of you on this slide. So first, family planning system usually helps each couple to plan wanted child. And we know if a child is wanted, usually there is better care. And if the reproductive health is better, then the delivery is better, pregnancy, delivery, and then the baby is raised better and cared for. Then when we are talking about building reproductive health, we mean people of adolescent age, and those are older children and adolescents. And if we're talking about healthcare community is supposed to help each adolescent to build and to ensure their good reproductive health. So when they reach adult age and they want to have a child, so it's necessary to ensure that their body and in general they are ready for parenting. And this is step 3 of our ladder if we're talking about the reproductive health status. And then if a family wants to have a baby, a family needs to be prepared in terms of responsible parenting. And unfortunately, building reproductive health in Ukraine is not happening the way we would like it to happen. So you can see the changes in sexually transmitted infections incidence in girls under 14 in Ukraine on this slide. So those are really young girls. So their future reproductive health is probably going to be impaired. So have a look at syphilis rates. So there is an increase even from 22 to 23, and trichomoniasis. All in all, we can see 5 of them in front of us: syphilis, coccal infection, chlamydia, trichomoniasis, and ureaplasmosis. So there is an increase from 22 to 23. We don't have the statistics as of 24 yet. So that's why I'm going to say that probably there is an impact of war in Ukraine as well because of this rise. And here you can see the sexually transmitted infection rates in women. It looks like it's positive. So if you look at 2024, so all the values have decreased, which looks very positive for reproductive health, but still they're there, and it's quite high if we can see if we talk about trichomoniasis. So the reproductive health status might be impaired in those women who currently have trichomoniasis or who have had trichomoniasis. With regards to abortion rate as an indicator of efficacy of family planning system, unfortunately, it's not as efficient during 20 years, although you don't see those years in front of you. There is only the interval 18 to 23. But for about 20 years, Ukraine has been a country, one of the countries where the abortion rate were decreasing, but in recent years there is increase, and from 22 to 23, as you can see, like in 22 it was 22.9 per 1,000 women of reproductive age, but 23 shows 23.9. So we can see not a trend yet, but we can see an increase in this value. But of course, when we have abortions in girls and adolescents under 14, and of course, luckily, those columns are very low, and there is decrease from 22 to 23 years. But this is about the adolescent girls under 14. But if it's 15, 17 years of age, you can see the increase. This is the age when a girl actually is almost at the time when her reproductive health is supposed to be already developed. And there was decrease in 23. So far, there is no statistics as of 2024. With regards to mother-to-child HIV transmission rates, Ukraine today looks not bad. I would put it this way. So in Ukraine, the value is 1.5, and Ukraine actually is reaching elimination of mother-to-child HIV transmission. So we are going there. And so far, we are not applying to WHO yet, because WHO would like to say that not all regions participate in elimination process. We are talking about HIV, when babies are born with HIV. And reproductive health status actually is something important when we talk about pregnant women. A pregnant woman is basically two persons. And the fetus will become a baby and will become a person with reproductive health in future. So here you can see changes in diseases of circulation, genitourinary system, and anemias. And you can see some growth in recent years. Once again, to mention, there was decrease for about 20 years, and you can see some decreases. And there were quite high indicators, very good decrease of all those three indicators. And they are showing the health of pregnant women the best way, which is a very good depiction of reproductive health of each woman who is giving birth. Unfortunately, overall health is worsening. And being an health manager in the area of maternal child health, it's very worrisome to see the increase in cesarean section rates in Ukraine. So we analyze, we are trying to see why it's happening. We don't see any causes why it is happening. Well, maybe the only thing to say that OBGYNs, maybe not all professionals, meaning the way they should perform their professional duties. And in order to decrease maternal and perinatal mortality, the rate should be 15%, not 26 or 28. And we are talking about tertiary level healthcare facilities. So almost 30 that we are having in 21-23, and that is not only tertiary, but secondary and primary healthcare facilities as well. Here, I would like to point your attention at reproductive losses, and they impact ensuring reproductive health. If we are looking at direct causes, physiological causes, infertility, genetic abnormalities, hormonal disorders, medical complications, miscarriage and stillbirth, pregnancy loss, pregnancy complications as a cause of maternal and infant mortality, environmental and social harmful substances, malnutrition, traumatic loss of reproductive potential, infectious injury to reproductive organs. At the same time, there are indirect causes not affecting directly, but they decrease birth rate and make the reproductive potential lower. Socioeconomic, very characteristic for Ukraine, cultural and psychological, especially during the war, psychological condition of women and reproductive age women in particular, educational and professional. And Ukraine today is in a deep demographic crisis. So we would like to have the birth rate that would be able to replace one generation, but at least the same generation. But for Ukraine, it's 0.8 today, right? And political and legal. Weak state support for families, wars, and conflicts. So we have our war going on in our country. So now about reproductive losses that actually affect reproductive function. 15 to 25% of women globally have inflammatory diseases of genitalia, and we are talking about STIs as well, and they affect reproductive health the most. And we also know that every sixth person in the world suffers from infertility. It's about 18%. According to WHO, difference in rates, and again, I'm pointing your attention, this is between high, middle, and low income countries, is insignificant. For example, 17.8% of population in high income countries and 16.5% in low and middle income countries suffer from infertility. And speaking about past information, pregnancy loss, annual loss was about 36,000 unborn lives. So 36,000 babies were not born. And of course, that means that they will never have their reproductive potential. Infertility was about 5 million women of reproductive age. Genetic causes also impact reproductive potential. For example, in men, 10 to 15% of reproductive problems are related to genetic conditions. In women, it's 5%. They have difficulties to conceive, and it's due to chromosomal aberrations and specific reproductive losses. So here you can see changes in maternal mortality rates for the period of time from 10 to 24. And I'm not shortening the time interval because it's really important to see, because it depicts the socioeconomic status and the maternal and child health changes. In 24, unfortunately, we lost 48 women. They died during pregnancy, childbirth, and in the postpartum period within 42 days after delivery. So this is the interval, 42 days, when this mortality is considered maternal mortality. And of course, those 48 women will never give birth again. Here's neonatal mortality. It looks like it has a trend to decrease, but this is very slight decrease, and I don't know whether we can call it a trend. So in the year 2010, it was 3.9. In 23, it looks like 2.2 lower, but we are losing children. They will never grow up, never give birth to their children. Neonatal mortality for babies with 500 grams weight or more, also shown here. So total absolute numbers is 379 for those who were born live, but still the difference, you can see the difference. So these are the direct causes of reproductive loss. And among term babies, this value is much, much lower. So premature and term also differ. And pregnancy loss, also pregnancy loss increase is almost double. In 23, it was 3.6. This is for preterm delivery. But in 24, preterm delivery is 5.8. So there is a decrease, which is twofold. And this is cancer incidence rates. Also, it impacts reproductive potential. We know that cancer of genitalia and also breast cancer in women today has a trend to decrease of the age when a woman gets cancer. And also I would like to show you cancer of genitalia. About 11,150,000 women have this cancer, not of reproductive age, but total women, younger, older, and it's quite high. So 50.7 per 100,000 women. Also, I would like to mention the following, that the number of women of fertile age also impact reproductive health in Ukraine and ensuring reproductive health. And unfortunately, in Ukraine, the number of women of reproductive age have decreased dramatically. So in 2018, almost 10,000. So 10 million, but 9.5 in 2022. You know that because of war in Ukraine, there is a lot of migration, a lot of IDPs in Ukraine, and for those people, there is difficult to give birth, to deliver. So that's why the rates are such. So what Ukraine is doing and how we are tackling the problem of increasing chances to ensure better reproductive health in Ukraine. So here you can see a table, but that is as of 2017. I don't have any newer data, but this hasn't changed. And I will tell you later why I know that it's not changed. So I'm showing you that spontaneous abortions, when ART is used, 4.3%, it's quite high. With regards to clinical pregnancies, 34%, but delivery happens only in 27%. This is with ART, assisted reproductive technologies use. Using ART methods, as you can see, there is a trend towards the increase. On one hand, it looks like a country that's heading towards improving chances of babies being born, and it looks like we are giving the opportunity to women to give birth to babies with help of ART. On the other hand, what it shows that we have problems of reproductive potential in Ukraine. Same situation with assisted reproductive technologies use. You can see the absolute numbers. And here's live birth with ART after cycles of ART starting from 1999. So we have since that time 62,360 babies were born thanks to ART. So here's the case when I mentioned before that the rates are not changing since that time, because I'm a member of a group that's developing the state guidelines for ART as part of the benefits package of treatment of infertility using assisted reproductive technologies, in vitro fertilization. And we were involved with other colleagues to develop that document, the list of reproductive technologies. And in Ukraine, regardless of the war, Ukraine gets the state support, financial support for that. but the overall number of women of reproductive age is decreasing. So that is why I believe that the status of reproductive health, building reproductive health issues, reproductive and pregnancy losses, reproductive losses is something that we see, but partially we can get out of that situation thanks to arity. So that is the situation in our country with reproductive health. Thank you for your attention.